When Andy Mueller goes to work each day, he does not lack for challenges. For about a year now, Mueller has been the CEO of Maine Health, which is the parent company of Maine Medical Center in Portland, as well as hospitals in Farmington, Norway, Brunswick, Biddeford, and more, a total of 12 community hospitals across Maine and New Hampshire.
Maine Health employs about 22,000 people and has to deal with virtually every healthcare issue you could name, from the pandemic to opioid addiction to the ever-rising cost of health care. Mueller says he is committed to making real changes in the healthcare system in Maine. He practiced as a doctor before moving into hospital administration, and the first thing we wanted to know is why he made that career switch. It's a very different job to get involved in hospital administration versus being a doctor. That's a real leap. What was it that made that appealing to you?
You know, I saw an opportunity to advocate on behalf of patients and other providers, and that was really what first drew me to the table. After sitting at the table, began to realize I could have a bigger influence than simply seeing patients in my clinic every day. Although I still ask myself that question every morning. Am I creating more value in my current role than I would whether I was seeing patients in a clinic? And if the answer is no, then I'm happy to go right back to seeing patients in a clinic.
Really?
Yeah, absolutely.
Why did you want to take the job at Maine Health?
So I saw a unique set of characteristics at Maine Health that really don't present themselves anywhere else. I think we have a greater opportunity to truly live our vision of working together so our communities are the healthiest in America here than anywhere else that you can imagine. And I'm bound and determined as an organization, we're going to turn that vision into reality.
Just my opinion, but my thinking would be that running a major healthcare operation in this country, in this era, would just be one headache after another without a lot of rewards.
Yeah, no, I don't see it that way at all. I think we have an incredibly important role to play, certainly in the community. Patients aren't happy, doctors aren't happy, nurses aren't happy, payers aren't happy, the government's not happy. We've got to do things different, and I think there are a set of circumstances in Maine and New Hampshire and at Maine Health that give us a greater chance to really change healthcare and make it better for everyone.
It's an interesting system because, as you say, just about everybody dislikes it. The people who are in it, the people who are on the outside, the people who are served by it, everybody's got a grievance. And those grievances are legit.
Yeah, that's why we got to change it. So I was in a community where we had significant competition, which sometimes led to significant overinvestment in things that didn't really meaningfully help large segments of the community. We can't afford to do that here. We've really got to think about how we create true access to care, and that means affordability, it means health equity, it means convenience, it means all of those ways that people need to access care. We've got to figure out vehicles and mechanisms to enable that. It's not going to be easy. We've got a long way to go, but I'm confident we can put ourselves on a prudent journey to really accomplish that.
Give me an example of just one thing that you would like to change in the Maine healthcare system.
I would love to continue to focus on empowering our frontline care team members. So when you're sitting across from a patient, you feel completely empowered to do the very right thing for that person sitting across from you, without fear, without worry, confident that you're going to be able to create the best outcome for that individual.
You know way better than I do about how many doctors are so frustrated, exasperated by the amount of paperwork that they have to deal with, the insurance stuff they have to deal with. Everybody knows it's a problem. Doesn't appear that we're really making much progress in changing it.
Yeah, it's going to be hard, for sure. There's some aspects of it that are helpful. The electronic medical record has been difficult, I think, for many physicians and APPs and others to adopt. But the reality is we have far more insight and information available to understand our patients. Now we've got to really understand what is important, try to focus our providers on that and eliminate some of the other stuff.
In every aspect of the U.S. economy right now, it's hard for employers to find good workers. You have a workforce of 22,000 people, many of whom have very special talents. How tough is it right now to find the people you need?
It is incredibly difficult. I mean, there's some estimates that there are twice as many nursing job openings across the country as there are nurses to fill them. And so one of the things we have learned is we're no longer competing against other healthcare systems in Maine, New Hampshire, and the region for talent. We're competing against California, Texas, Florida, and others. And as a result of that, one of the things we are really incredibly focused on today is our workforce development, and workforce development in Maine, partnering with with institutions of higher learning in our region to ensure that we're going to have the workforce we're going to need for the future.
Anyone who looks at the American healthcare system in a thoughtful way will immediately be struck by the fact that this country spends roughly 50 to 100% more than other comparable industrialized countries on healthcare, and yet we have about the same outcomes.
If you tried to design a healthcare system to give you good outcomes and drive up the cost of care, I don't think you could intentionally design anything better than what we have right now. And so fundamentally, we've got to change the financial incentives around how we deliver care.
Mueller says providers need to be financially rewarded for keeping patients healthy, not, as it works now, for giving them more tests, more treatments, more medications.
When I was a physician years ago, if a lot of my patients were getting the flu, for example, I would be devastated. It's a terrible flu season. Then when I would go into my executive role, it'd be like, this is great financially, it's a terrible flu season. That's perverse. We've got to change that perspective and change the business model. And I think we have a great opportunity to do that here at Maine Health.
Obviously, the challenges are daunting, they are enormous, but one thing that works in Andy Muller's favor is that you can maybe effect change in a small state like Maine a whole lot easier than you could in a bigger state, New York, Florida, California, a place like that. We shall see.
It's a big job.